There are four major types of angina: stable, unstable, variant, and microvascular. The most common type is stable angina. This occurs when the heart is working harder than usual because of the reduced blood flow. It typically follows a pattern and is brought on by predictable activities like after strenuous exercise or eating a large meal. The severity of the pain is consistent and usually goes away after just a few minutes of rest. The pain from unstable angina generally occurs more often and is more severe than stable angina. It does not follow a pattern. This condition is dangerous and could be a sign that a heart attack might occur soon. Variant angina is rare. The pain usually occurs at rest or at night during sleep, typically after midnight. The pain may be more severe and last longer than other forms of angina, as long as 30 to 60 minutes. It may be accompanied by shortness of breath, fatigue, and sleep problems. Medications may not help in easing the pain from this type of angina. To get started, quit smoking and avoid secondhand smoke. Maintain a healthy body weight, which means having a BMI between 18.5 and 24. Get plenty of exercise. In general, aim for at least 30 minutes a day. If you drink alcohol, limit yourself to no more than 1 drink per day for women and no more than 2 drinks per day for men. There are 4 main types of medication that are prescribed to control angina: nitrates, beta blockers, calcium channel blockers, and ranolazine. Finally, your doctor might also suggest a surgical procedure called angioplasty to open the coronary arteries. This may be recommended when lifestyle and medications aren't working well enough.
Angioplasty is a non-surgical or interventional procedure for patients who suffer from a narrowing or blockage of arteries caused by the buildup of plaque that restricts the flow of blood and nutrients to the heart, a condition known as coronary artery disease. During the catheterization, a guide wire is inserted through the groin, followed by a thin tube called a sheath. Another thin, hollow tube called a catheter is guided through the sheath to the arteries surrounding the heart. Dye, or contrast material, is then injected into the catheter. As the dye moves through the arteries and chambers of the heart, its movement is digitally photographed so the physicians can identify the locations of the blockages. After the location of the blockage is identified, the catheter, with a small balloon at the tip, is then reinserted near the blockage or the narrowing in the arterial wall. When the catheter reaches the blockage, the balloon is inflated, pushing the artery open and widening the blood vessel enough to increase the flow of blood and nutrients to the heart. Oftentimes, balloon angioplasty will involve a metal stent, which serves as a brace and keeps the artery open after the balloon is deflated and removed. The stent stays in place and the arterial wall heals around the stent with blood flow restored.